Whenever you're ready.
All right, I'm always ready. No, I'm just kidding. All right, I think we say hello all the time, right? Mr. Medine here, guys, Mr. M, and today we're going to be doing skull. We'll start off with the AP axial, which is the town method. We'll transition into a right lateral, and then we'll do a PA axial, we'll do the Codwell, and then we'll do the Haas, which is an alternate for the town. That's going to be PA axial. And then we're going to do something special. We'll do the SMV. SMV is not very common, but we're going to do it anyways just to help you guys out that are doing skull. So really quick with skull, we have to know the landmarks. So you have to know that this is the glabella, this is the nasion. What's this one going to be? You guys remember? It's going to be the acanthion. This is going to be the mentum. So you got to know those landmarks. You have to know that this is the outer canthus, this is the inner canthus, and here we have the EAM. So the EAM is going to be the foundation for all the lines. So if you have here, let's say your interpupillary line here, your orbital meatal line is going to be from your orbit to the EAM. So that's orbital meatal, that's OML. And then underneath it, we have the infraorbital meatal, and that's going to go down here. We have the canthial meatal line, and then we have the mental meatal line. So you have to know those lines, and you have to know the landmarks before we proceed, okay? So let's go ahead and get started. We're going to get started with the AP axial. We'll get started with the town, okay? So, I didn't hear you say action.
Action.
Okay, all right. So now we're going to go ahead and get a receptor. We're going to put it in lengthwise here, just like this. Put that in. I'll put my marker in there just a little bit. I'm going to slide that up. Make sure not to be banging things around because you're going to go ahead and, it's going to maybe upset the patient or scare them. We're going to bring his head down this way here. I want to see how much more room I have. So, sir, I'm going to have you slide down this way a little bit. All right, right there's good. All right, slide him from here. I'm going to make sure I detent, transverse detent. All right, you hear that little click right there. You feel it go into a groove. I tell the students when you're detented, you just feel it in your soul. All right, so we're going to come right over here this way here. And we're going to make sure so that you close your eyes. All right, because we're going to turn this light on right here. You're going to get this light shining in your face. And we're going to be doing a town. Town is the method. The projection is AP axial. Now here, if we take a look here, his OML, right? We're going to just tuck your chin down a little bit. Can you bring your chin down? There we go. So let me get a ruler, and I'll show you guys with the ruler. So here is the EAM, all right? And then if we just tuck your chin down right there. So from the EAM here to the eye, we can see that you're getting it to be perpendicular. That's what you want. That's the OML. Now, if he wasn't able to go ahead and get his chin all the way down, then you would go off the IOML, which would be right here. So you have to come down a little bit right there. And this would be the IOML. So he's able to tuck his chin in right there. There we go. And now you see that outer line here from the orbit to the EAM. That's your OML. So you want that to be perpendicular, okay? So we're going to go ahead. I'm going to turn this light on here. And we're going to be centered right over here. But we're going to angle the tube now 30 degrees, caudal. Okay, so because we're using the OML, and then we're going to go ahead and place this 2.5 inches above his glabella, which is about 3 of my fingers here, just like this. So I'm going to go ahead and get this centered here, just like that. Close that up. Keep your chin tucked in right there, sir, right there. 2.5 inches. So that's the central ray. We're going to get the mid-sagittal plane centered here down the middle. And because we're angling 30 degrees, we got 5, 10, 15, 20, 25, 30. I'm going to bring this down 2.5 inches above the glabella, which is about 3 of my fingers here. I got that centered pretty close right here. I'm going to close that up. All right, just remember to keep your chin tucked in right there. And notice I'm collimating around his head. I'm just going to put my right marker right here, just like this. This is the right side. Make sure he's centered correctly. All right, mid-sagittal plane. I'm going to turn his head just like that, right there. Want that line going down his head and down his face. And this is it. All right. So you make your exposure, x-ray clear, beep. The mass on this would be about 20 mass at about 74 kV for an average size skull. Okay. All right. So this is your AP axial town. Now on the town, you're going to see the foramen magnum, and you're going to see the dorsum sellae within the foramen magnum. So I want you guys, all you guys, to think about what you're going to be seeing on each of these projections, okay? So again, you're going to see the dorsum celli, which is the back of the sella turcica. You're going to see it within the foramen magnum of the occipital bone. That's what we're going to be seeing, okay? All right, so you can relax. Now what we're going to do is have you turn over on your stomach here, and you're going to look this way, sir. All right, so we're going to transition into a lateral. Now we're going to go ahead and turn him this way here, and we're going to turn you a little bit out of an oblique, all right? You can bring this arm up if you like. All right, right there. Okay, so for the lateral now, we're going to go here. All right, and you see his EAM here? We need to go ahead and be right above the EAM. We're going to go 2 inches above the EAM, which is going to be almost 3 of my fingers here. There we go. Now watch this. We're going to open up the collimation to include his entire skull. All right, right there is good. All right, so the interpupillary line is a line from his eyes. You want that to be perpendicular. All right, his mid-sagittal plane, you want that plane to be parallel. All right, so I'm going to look here, and he looks like he has a little bit of a tilt, so I'm going to turn his shoulder. Watch this. I'm going to turn his shoulder, and now I'm going to turn his head. So now his mid-sagittal plane is parallel, and the interpupillary line is perpendicular. All right, so that's what we want. So notice his body is not in a lateral position. He's in a right anterior oblique position, but his head is lateral. I'm going to close up collimation just a little bit. Right there. I don't need his face. I just want the skull. And I have the skull in the back. I have the mastoid here, and I have the frontal bone. So we're good. Stay just like that, sir. Don't move. Make sure that this is centered. There we go. Don't move, sir, just like that. Again, technique is going to be about 20 mass at about 76 kV. X-ray clear. Beep. All right. This is going to be your lateral. How cool is that, right? Now we're going to go ahead and do a codwell. The codwell is a PA axial. So now we're going to have you turn, and you're going to put your forehead and your nose down on the table. Can you do that for me? All right. Okay, great patient, by the way. All right, so he's very cooperative. He put his arms down here. So I call the codwell, I'm going to share it. I used to not want to share with people, but I'm going to tell you, I call the codwell the forehead-nose projection. So the forehead and nose are going to be down. All right, we're going to go ahead and get him mid-sagittal plane in the middle. All right, there. Make sure I got him here. I'm going to go ahead and collimate just an inch on the sides, right there. You don't need to have the ears, but I'm not centered completely. I can see that. So I'm going to go ahead and move them just a little bit right there. Okay. You want it to be down the mid-sagittal plane. Now, since he's face down, I'm going to go ahead and put this down on the left side. Okay, this is his left side. And I put it face down because he's PA. I could put it here. His hair is here. I'm not going to get in the skull. But I'm going to go ahead and exit. I'm going to have to come down a little bit, and then I'll open it up a little bit more, because you want to be exiting at the nasion. All right, there we go. So I don't know if you can see this over here. I'm exiting at the nasion, and his nasion is right over here. Okay, that's the bridge of the nose on top of it right here. But that's where you're exiting for the codwell. So this would be a PA. Now, if you just did PA, the peaches ridges will be filling the orbits. But we're doing a codwell, and the traditional codwell is a PA axial, and we're going to go ahead and angle 15 degrees caudal. So now we're going to go ahead and show you guys a different way you can do this. So the reason I brought that up is because it comes up on the exams. So a PA with 0 degree angulation is going to be showing the peaches ridges filling the orbits. So now if you do it with a 15 degree angle, caudal angle, what's going to happen is the peaches ridges are now going to be filling 1/3 of the distal portion of the inferior orbit, okay? So again, the PA, if it's 0 degrees, it's going to fill, the peaches ridges will fill the entire orbit. If it's going to be a 15 degree angulation, the peaches ridges will fill the distal 1/3 of the orbit, okay? So this is going to be your codwell here. All right, so there we go. Okay, don't move, sir. All right, now if you were to increase the angulation to 30 degrees, all right, so I'll show you here, just if you did a codwell with 30 degree angulation, You'd bring this down 6 inches to 34. You're still going to exit at the nasion. And if you were to do it at 30 degrees, make sure we got everything lined up, the peaches ridges are going to push down below the orbits. Okay, so again, at 0 degrees, the peaches ridges are filled inside the orbit. If you guys are doing it with a 15-degree angle, it's going to fill the distal 1/3. If you use a 30-degree angle, the peaches ridges are going to drop below the orbits, okay? So I've done this a couple times in the field. CT has gone down. The ER doctors are like, hey, Robert, what can we do? You know, we need to see the inferior orbit, and this is what we'll do in the field, okay? All right, so this is your Codwell. Now we're going to do what's called the Haas method. Now the Haas method is the alternate for the town. So if you can't do a town, an AP axial, then we do a PA axial. It's called the Haas method. So for this one, we're going to angle cephalic, and it's going to be 25, 30 degrees cephalic. So 25 degrees. There we go. Oh, can't get into 26. All right. So 5, 10, 15, 20, 25. I do that all the time, you guys, even in the field. I should just know the numbers by now, but I always do that. So we're going to drop it down to 35. Okay. Almost there. Almost there. Almost there. All right. All right. So now we're going to go ahead and we're going to exit. It's going to be 1.5 inches above the nasion. Okay. So 1.5 inches above the nasion is where we're going to exit for this one here. And a lot of times I just tell my students, you know what? If you're centered at the glabella, you're going to be okay. Okay, so now we're going to bring this marker up here because the shadow is cast up here. I don't want that marker in the skull. So you see where I placed it here. All right. So this here is the Haas method. So the Haas method is, again, done if the patient can't be in a supine position for whatever reason. So the Haas method is a PE axial as an alternate to the Town method. Again, you're going to see the foramen magnum and the dorsum celli inside of it, but with the dorsum celli being so far away and the foramen magnum being so far away from the receptor, what do you think is going to happen? You're going to end up with some OID. And if you have OID, you're going to end up with some magnification. And if you have magnification, you're going to lose a little bit of the spatial resolution. Now, the last projection that we're going to show you guys is called the SMV. So I'm going to go ahead. I'm going to bring this back. And we're going to have you, sir, turn back on your back. All right. I'm going to put this on your lap. I'm going to slide this up a little bit here. This is an SMV that we're going to be doing lying down. We're going to have you sit up, sir. Can you sit up? I'm going to put these behind your back here, just like that. There we go. You're going to go ahead and come back. You're going to bring your head all the way back like that. There we go. All the way. There we go. So now his IOML is pretty near to being parallel to the receptor. This is called your SMV, your submental vertex. Here's the mentum. I'm going to be about 1/2 inch below the mentum. Mid-sagittal plane down the middle. So the beam right now, you guys, his head's almost, there we go. His IOML is almost to being parallel to the table. So I'm going to put a little bit of an angle. Watch your eyes. Probably about a 4-degree angle. Now, I'll do a 5. So now the beam is perpendicular to the IOML here. Okay, so as long as the IOML is nearly parallel and you get the beam perpendicular to it, you're going to get the SMV. I'm going to bring this up. And I can't bring it up anymore. So I'll bring him down. And I'll just bring it right here. There we go. So 1/2 inch distal to the mentum. I'm going to close that up. Put my left marker here. All right, so this is the right marker. All right. And I'll put it right here just like this, face up. And this is your SMV. It can also be done sitting in a chair as well. All right, so this is your SMV. This is known as your submental vertex. The SMV, we don't really do it a lot in the field. I don't want to keep them here too long like this, but it's going to be demonstrating both skull anatomy, facial anatomy, and sinus. So it's one of those projections that can be shown, showing all different type of structures. This would be like an axial if you were to do CT. All right, so I'm going to get him up. I feel bad for keeping him in this position. But again, it can be done if the patient is sitting in a chair, and you can do it where you have the patient put their head back and they're sitting up. Let's have you sit up, and I need you to take a deep breath. Okay? Put your hands down on the table, feel the table. You okay? All right. So we'll have you swing your legs out this way here. Just take a deep breath. Always keep an eye on your patient. Take a look at the eyes. Be in that position a little uncomfortable, huh? Yeah. All right. Now just think about it. If your patient was in that position, right? All right. So we've gone through quite a few projections of the skull. We kind of just all bunched them up. Again, you guys, this is the skull. I'm hoping this will help you out. We'll do a separate video for facial and sinus, and we'll do that in maybe a week or two, okay? Hello, everyone, you guys. Thank you very much for watching the videos. I'm hoping that they're helping you out. Please make sure that you subscribe and that you hit the notification bell to be notified about new videos. Again, remember to be good to yourself and be good to others. Thank you.